Assalamualaikum warahmatullahi wabarakatuh. My name is Ririn Dwi Aryanti. I'm from class 2A. Here I want to present about stereotype which concerns people's mental health. Slide 1 is background. Stigma refers to negative attitudes that discredit and exclude individuals because of particular condition, such as mental illness. First, its impact includes social isolation, where patients are avoided by society. So, discrimination, where patients are treated unfairly in various life areas. 3. Barriers to accessing mental health service occur because patients fear being judged or ostracized. In Indonesia, strong cultural and traditional values often reinforce stigma due to myths and negative perception about mental illness. Next slide is research objective. The study aims to explore various forms of stigma experienced by patients with mental illness and mental health nurses. It also seeks to understand how Indonesian cultural context shape the stigma, recognizing culture's important role in society attitudes toward mental illness. The third is methodology. First, the study used deductive qualitative contact analysis, which involves deeply analyzing data acquired by existing theories and concepts. 2. Participants include 15 patients and 15 mental health nurses to capture perspective from both groups. 3. The research was conducted in a psychiatric hospital in West Java, providing a specific local context. 4. Data was collected through semi-structured interviews, field notes, and hospital document reviews for comprehensive insight. Slide 4 is key themes. First is perceived self-stigma. Stigma felt internally by patients themselves, like shame. 2. Public stigma. Stigma coming from the broader community. 3. Family stigma. Stigma originating from patients' own families. 4. Employment discrimination. Stigma faced in the workplace. 5. Professional stigma. Stigma experienced by nurses and mental health professionals. Slide 5 is perceived stigma. First, patient experience feeling of shame, blame, and being looked down upon. Second, they are often labeled as crazy by society, harming their self-esteem. Third is this led to social isolation, where patients feel lonely and rejected. Fourth, an example quote from a patient is, "My heart cries without tears," showing deep emotional pain. Slide 6 is public stigma. First, community members often reject, fear, or even act violent towards patients with mental illness. 2. There is a mistaken belief that mental illness is contagious, causing people to avoid patients. 3. Third, as a result, social support is very limited, making it difficult for patients to be accepted or helped. Slide 7 is family stigma. First, family may feel ashamed of their relatives' condition and choose to hide the patient. 2. Some families deny that the patient belongs to them, distancing themselves emotionally. 3. Sometimes family even refuse to bring the patient home after hospitalization due to fear of social judgment. Slide 8 is employment discrimination. First, patients often face rejection without trying to return to work, even if government jobs are expected to be more secure. Second, they lose job opportunities and self-worth because of stigma, worsening their mental health. Slide 9 is professional stigma. First, mental health nurses are sometimes called crazy nurses as a form of derogatory labeling. Second, they are viewed as strangers by the public and even by their colleagues. Third is stigma puts pressure on nurses and can reduce the quality of mental health care they provide. 10 is conclusion. Stigma toward mental illness is multidimensional and widespread, affecting patients, families, workplace, and healthcare professionals. Since stigma is strongly influenced by culture, culturally tailored intervention are necessary to reduce stigma and improve mental health service in Indonesia. My recommendation is public education and awareness campaign educational the general public to increase understanding of mental illness, dispel myths, and foster empathy. This is crucial for reducing fear and discrimination caused by ignorance. Second is training for mental health professionals, providing special training to improve mental health workers' skills in managing stigma and delivering better care. Also to support them in coping with stigma they face themselves. Third is community and family-based interventions programs that involve families and communities directly, since they are the main environment for patients. This approach aims to improve social support and reduce. Okay, that's all from me. Assalamualaikum warahmatullahi wabarakatuh.